Okay, thanks. We're back. This is Senate Health and Welfare, and we're going to continue our work with our committee bill. Nolan Langwell, Joint Fiscal, has given some further information to Jen about the financial, the fiscal note on the bill and what's needed. So we'll see that. We'll get that.
Right. He told me that there was. Jen Carter, legislative counsel, told me that there was.
Yeah. So he hasn't put it together yet, but it's not. It's the request from the agency, and so what they need is what they need. So we'll add that in as part of their work and as part of the appropriations piece. And then we had questions, Jen, both from Senator Douglas and Senator Bullock, and I think they're really go ahead. Senator Yeah.
Okay. Yeah, I think Senator Zulk and I are in agreement on the on page 31 of the reports. Just to make sure that in section 13 and 14 that there is language that places an emphasis in the reports on the ongoing effects of what we're doing here with the price and everything. What are the effects of having that been implemented? And then as
Sorry.
So I know, sorry, I'm trying to classes. I know we're all running.
Are you thinking of that for both of them?
Yes.
Okay.
Yeah, just include language that has an emphasis.
Okay, so
for that.
that's.
Whether it's good or bad.
Yep.
Yes.
On Vermonters and Vermont Healthcare System. That one.
Yeah.
Okay.
And then also 13 and 14, make sure that it's not just a one-time report, that's ongoing reports, maybe.
Updates.
Yeah, and updates, yeah.
For how long?
I was thinking every 2 years. Or
upon request, which one makes sense? Do we put a firm time on it, or?
I think the question is, do you want, you are setting things up that are going on for a while. Do you want to be getting an annual update when you come back in January on how they're doing with things? Do you want that for a few years? And then, do we have them report annually for 3 years and then you can see where things are at, or do you
Let's
want?
start with annual and then move to, and then we can decide.
Once a biennium.
Yeah. Once a biennium?
Yeah.
Okay.
Okay,
So the first year of the biennium,
uh,
do that.
okay, but you also want to hear back from, it sounds like you sort of want two different things. You want to hear from them with these November and
Yes,
February dates, but then
Yes.
you also want to have an ongoing
yes.
every.
And just like annual, we put
biennium
annual in
there.
because we can always, it's updates. It's not a big deal. Well, it is a big deal report, but it's in a way that's.
And the timing for after this first year, you have November and February, November for AHS and February for the Green Mountain Care Board. Are those the times you want them to keep coming back, or do you want them to be?
I think subsequent years to keep it in November.
both?
No. Subsequent years to keep it on or before February 15th.
For both of them?
Yeah. That gives them time and it gives us time.
Thank you.
Yeah, thanks. It's good. So Senator Gould, does that cover your thoughts?
That does, yeah.
Great minds.
Okay, let me think about where to put it, with it being an ongoing requirement. I may put it right into the statute somewhere.
Okay,
We will have the first one and then,
okay.
separate, at least for HS, since the date is not the February 15th, but, yeah, let me think about that, but that's fine.
Okay, so, can we do a high fly through of the bill? We have time to do that.
This bill.
We need to do that. What committee do you need? What more do you want to do before we, let Jen get to, we move ahead?
Move on.
Move forward.
Move forward. Keep going.
All right, okay, so that's good. I do, so Nolan did mention the AHS. There are some limited service positions that they're gonna be asking for. It will increase the appropriation that's there. And originally I had given a figure that now is exactly the figure I'd given earlier, so that's a pretty good estimate, right? Yeah, appreciate it. Okay,
Yes, and I did look last night at the health IT fund language. It does not seem like a natural fit for the kind of IT system standardization of data and hospital data submission stuff. So we could look at modifying the language or notwithstanding the language, but it is much more about adoption of electronic health records and
maybe we should notwithstand it and see what happens. Do you think that's something we should do? Or is it something that should happen in appropriations?
it probably makes sense for you to send the bill out in whatever you think the strongest shape is and allow them to make changes as they deem appropriate.
Okay, so that would go into the appropriations section?
Yes, so do you want me to
Yes,
notwithstand?
yes. Let's do that.
Okay,
And
so I-
it's accessible to us.
And we'll be taking that out of the general fund to start, so.
That would be, which,
It would be C3 on page
yes,
33. So it'll change the big number because we'll be taking less from the general fund. It'll be pulled out as its own. I may do HIT as a B1 and B2, but one of them will be an outstanding.
so I think you can be prepared. Okay,
Okay,
good, thank you.
yes.
Okay, okay, committee.
Right, and I should say, it doesn't strike me as wildly inappropriate, it just doesn't fit the existing
That's the
statutory
current definition, right, so,
So if I can just recap then what I think, the changes I think I am making, does that make sense?
yes, please.
At this point, okay, so I think I marked them in here, so on the minimal, but on the first page, I am gonna just add promote the transformation, because promote transformation, or promote transformation of, I feel like we needed that. That's really small. Then the next one is on page 25. And if I know of things that people around the room want to talk to you about on this, do you want me to flag that too?
Yes, please.
Do you want to hear from
Yes,
Mary
please.
Page, the brief thing?
Yes, hi, Mary Kate Molden, for the record, Director of Vermont Public Policy of Bi-State Primary Care Association. I was just looking at the advisory committee.
Uh-huh.
We appreciate being on there. I would ask that we strike that it be limited to a licensed clinical professional, and that we have the flexibility to identify the best person for that advisory committee.
Which,
So we're on page 25.
Or page 20?
And, yeah, page 25. I put it up on the screen. This is the advisory committee.
right,
This is the list that we
Right.
pulled from the Rural Health Services Task Force. So as I said, some of them may have been more specific to that task
letter?
force. So
what letter are you looking at specifically?
F lines 5 through 7. It says one representative of Vermont's federally qualified health centers
Okay,
who shall be a Vermont licensed healthcare professional. And so I think the
Let's
request would be to
strike
strike that who shall be a Vermont licensed healthcare professional and just a representative.
is that okay? I have fun with me.
Sure.
Uh-oh.
No, Vermont Medical Society, I didn't, if you are taking brief comments, we actually would respectfully request the same in line G, just to again have the flexibility, whether it may be a practice
Okay.
administrator, staff member, or a health professional.
Okay,
Thank you.
So, just on that one in particular, if I may, should we be specific about it? Right now, with one Vermont licensed physician from an independent practice, should it be one representative of independent physician practices? Does that make sense? Okay.
Thank you. Yeah. Especially with the folk being often on the payment structure, maybe the best person may be
Somebody
CFO,
else.
Yeah, a practice manager. So that just gives us the flexibility to
And I-
get the right person.
Thought of that because I turned to the next place where I was gonna make a change is striking the,
For primary care physicians, it might be better if they were to see patient
And they also might get it more available.
You had given them that flexibility.
I gotta remember that for the floor report.
All right, so that comes out, so that changes, okay. And then on page 27, I am adding an annual update and requiring insurers to provide clinical and claims data to the agency of human services for purposes of this integration work.
Yeah.
And then, page 31, there's the report stuff we just talked about. So add to both of them the ongoing effects of these efforts on Vermonters and Vermont's healthcare system, and make an annual report requirement based on each of these, including that additional piece. And then we will be having, sounds like some potentially additional positions for section.
Limited service
15,
positions.
yeah, I would- Yeah, I draft them separately, but in that, probably in that same section. And then, some modifications to the appropriations, both to reflect the AHS positions or other requests, and, to have this 150,000 come from the HIT fund, notwithstanding any of the criteria to the contract. Does that sound like what everybody is expecting for whenever I draft this? Okay, great.
Right, yes. Let's do this. We have, yes, is that okay with everybody?
2 thumbs up.
Great. Yeah, we got thumbs up on that. We are ahead of,
Yes.
yes, Elizabeth.
Hi, Elizabeth Poggett, Agency of Human Services. We would like to request, please, that similar language that excludes Medicaid from global budget be placed in the reference-based pricing section. Just because we know that when we're interacting with the feds, they're probably going to do their due diligence and look at the statute. And so we want to just call that out so that there's nothing confusing about our reference-based pricing and the 1115 paper.
So
It's specific to health insurers. which
Yeah,
is
that's-
commercial
that's
insurers and
about
third-party
insurers.
administrators.
yeah, that's what we did talk about that yesterday or whenever. So it doesn't affect. Okay,
Does it explicitly say insurers?
no.
Yes, it
Well,
explicitly says
where are
health
we?
insurers.
Yeah.
Okay.
You're okay.
I changed it. There's a definition in 18 PSA 9373 of health insurer that says it's commercial insurers and third-party administrators to the extent permitted under federal.
What page is that on, Jen?
Which piece? The health insurers?
No. Page,
The
the
definition is not.
page pricing is on page, begins on page.
Yes, I mean, we talk about it a little bit in just in updating the board's duties, but then we talk about it starts in earnest on page 6.
Yeah.
And it's health insurance.
Yeah, and so that's a 9373
90
definition.
Right, 9373 is not in the bill because it's not being amended, but it's the definitions. It's also where the definition of healthcare professionals is that says it's, licensed providers and facilities, licensed individuals.
Okay, thank you.
Okay, good clarification. Thank you. Okay, good. Okay, anything else, committee? Okay,
So if
so,
there's something else you want to do with my time, and then
Yes.
one of you other people to hear from on some of the other bills.
so we have S 63.
I brought you an amendment.
Yes, you did. And why don't we look at that and understand, because I have the bill as we received it, we have something else from you.
Yes, it was a fairly small amendment. So I did not do a strike all. I did strike the one section and put it back in. So let me just this and show you remind you of what's in the bill itself as well.
We're on draft 1.1.
Yes, but actually, I think first we're gonna just look at the bill again to remind ourselves what is in it.
Mhm.
S-6030 is the bill dealing with the modifying the regulatory duties of the Green Mountain Care Board. The section 1 eliminates the role of the Green Mountain Care Board in reviewing and approving the Health Information Technology Plan. But does add a representative of the Green Mountain Care Board and a voting member of the steering committee. As I understand it, the member of the board is currently a non-voting member of the HIU steering committee. So it takes out references to the board and puts the board in as the recipient of the report, since they will not be receiving for review purposes. Similarly, takes out references in section 2 to the board's role in reviewing and approving the plan and reviewing and approving Vital's budget. Section 3 is amending the bill back formula
On page
on page 6, bottom of page 6. Says expenses, many expenses of the board are divided between the state, hospitals, and health insurers, and currently accountable care organizations, but with the closing of One Care, taking out the ACO and dividing in some way there as proposed by the board, putting most of that back to hospitals, which have been contributing with funding of the ACO, and a small amount on the insurers.
This is also in the big bill. Budget bill. Okay. Is that a big bill or is this?
I think you mean the budget big
The
bill.
budget big
Okay,
bill.
yes,
Budget,
just
the budget big bill. I don't know, we gotta clarify.
thought there's only one big bill.
Yeah, it is. It's the big bill.
Choose your terminology. Section 4 is the duties of the board. So again, taking out the references to the board's role with respect to health and information technology, including reviewing and approving the HIT plan, reviewing and approving criteria for connectivity, and health information exchange, and reviewing and approving Vital's budget. Also in number 12, taking out language around reviewing data regarding mental health and substance abuse treatment reported to DFR, and discussing information as appropriate with the mental health technical advisory group, because neither the statute referred to APSA 4089 PEG 1G, nor the technical advisory group currently exists. That's really just yeah. Section 5 is the oversight of ACOs. Some pretty significant changes in this section, expanding not just the scope to be not just ACOs that receive payments from Medicaid or commercial insurance, but really because they're mostly Medicare ACOs at this point. For operation in Vermont, ACOs must obtain and maintain certification from the Green Mountain Care Board, with scales down the items that they are reviewing, looks for consistency with principles for healthcare reform, looks to make sure that the ACO's financial incentives for providers and patients are reasonably calculated to improve or at least maintain the quality of access to and affordability of care. Again, they're striking a number of provisions they no longer expect to be relevant. And then there's also a number of changes regarding the budget review. So this language allows the board to adopt rules to establish a streamlined process for certification as a Medicare only ACO, for instance, to be authorized by CMS to act as an ACO under the Medicare program. And then we have the budget review. So this would specify that that's budgets of ACOs that receive payments from Medicaid or commercial insurers, or both, and streamlines a lot of what they would be looking for that perhaps is less relevant without a large ACO and healthcare model. Puts in some more streamlined review criteria. gives the Office of Healthcare Advocate the right to receive copies, not just of budget review material, but certification materials. You know, and then there's fees. So there's a $10,000 initial certification fee. That's okay, Bill back. I was coming to you for Bill back anyway.
Okay,
Right.
You're gonna get Bill back, right? You're
I'm
gonna
just
get-
trying to figure out what I'm doing next week
Yeah.
and schedule.
Oh, that's not too long, you know.
$2,000 for recertificate to maintain certification, and then if an ACO needs to have its budget reviewed because it's receiving Medicaid and commercial insurance funds, then it would be $125,000 budget review. Section 6, and if all of these get enacted, this and the other bill we're working on, another one's upstairs, but I'm gonna have to do some work in the statutes this summer to make sure all of your changes get reflected, because we're amending a lot of the same statutes, but I think we're still okay, not in conflict. This is the piece in section 6 around the fiscal year for hospitals and having the current October 1st to September 30th fiscal year maintained for general hospitals, but allowing psychiatric hospitals not maintained by the state, which is really rather to use a calendar or fiscal year, which I understand is better for their accounting. Section 7 is the one that the amendment would strike out and put in a new section 7. This is on the budget review, hospital budget review. And so in existing law, or in the bill as it was introduced, there's the language about it not being a contested case and what the appeal process looks like. And then some conforming language with the previous section around the timing of the hospital fiscal years and the timing of the budget orders. And then some more deleting some language about the existing appeal process. So in the amendment, I've stripped out the appeal process contested case stuff and just left in the conforming changes with section 6 around the hospital fiscal year timing. That's what you'll see. Section 8 modifies language around the meetings of an ACO's governing body. And recognizing that we may have fewer, this one would just be the governing board of an ACO that contracts with Medicaid, so it would not apply to the Medicare onlys. Section 9 repeals the board's duty to conduct a Medicaid advisory rate case. Title 18. And then finally, we have effective dates. The timing pieces for the hospital budget years take effect, and the section take effect on passage. The remaining sections take effect on July 1st. This also, of course, in section 7 as introduced, applied to those contested case appeal provisions, but in the amendment, I'll put up next, the revised version of we're gonna have a short amendment. Yes, it is a short. Sadly, it goes on to 2 because of the committee vote, but
Right. The need of it.
and we
don't need to do a strike roll on this.
it didn't seem necessary to do a strike vote. So here's the amendment I drafted for you. So this would just strike out section 7 in its entirety and put in a new section 7 that's just about those dates. The fiscal year and the written decision, the due date for the written decision. So again, keeping the status quo for all hospitals except, I believe in practice, except Brattleboro Retreat, and allowing them to have a January 1st through December 31st fiscal year, and therefore the board's budget order date or establishment date moves to December 15th. A written decision by December 31st. And that's it. And that's all that would be in section 7.
And so we heard when we first went through the bill that the only part of the bill that felt contentious was the section that we've struck. And it seemed like a longer set of conversations and testimony before we could get to resolution on that. And it does make sense to keep moving what we can move forward on board authority and work. They've asked for this. It's in some ways feels more like a technical correction, although it's not, it's more than that. And we did reach out to the board and we did reach out to the hospitals. And I think things are good there. I'm looking at Devin, I'm looking at Susan and Diane. We're good. It's good. Okay, so committee, we can,
Would you like a motion?
huh?
Would you like a motion?
Yeah, do we have a piece of paper for the clerk?
I do, yeah.
Oh, good, the clerk's got ready. Right, so we would like a motion, please. I think we're moving first on the amendment and then on the bill as amended to send to the Senate.
Well, I don't have, do you have a paper piece? Do you have any of the amendment? I just,
Wait, hold it.
or do you want to make the amendment?
The amendment.
There's the,
From the organization.
okay, okay, ask it later. I would move that we amend S63 with draft 1.1 dated 3/13/25 at 5:09 p.m.
I will second the motion.
Discussion? Okay. So clerk?
I don't, yeah, you have to call the roll for an amendment. Okay.
That's our report out of committee, is the amendments. We gotta do it.
Well, you have to go.
And then we're,
This is just the amendment to the bill. You have
I
to
know.
call the roll
we do both.
to the bill. Okay.
So I will call the roll. Please say, yes or no. Senator Hart. Yes. Senator Cummings.
Yes.
Senator Douglas, yes. Senator Bullock.
Yes.
Senator Lyons.
Yes. Question is, who would like to report?
No, we have to, I move approval as.
Oh,
amended.
God, right, gee, sorry.
I do it all the time.
Thank you, Senator.
I need to get them to me so I can get them out.
That's right.
That's true.
So I move approval as amended.
Thank you.
Do I need to second that?
Yes.
I'm second.
One more.
Hmm?
Voting for days, I need just.
Any discussion? You could have. Okay. Hearing none?
I'll call the roll on the bill, as amended. Please say yes or no. Senator Hart. Yes. Senator Cummings.
Yes.
Senator Douglas, yes. Senator Bullock.
Yes.
Senator Lyons.
Yes.
Cool.
Now, we're looking for someone to report this bill. Who wants to report it?
I'm reporting S59.
So. You want,
I mean,
if you're not interested, we'll give it to,
I've already got one.
I know she's already got one.
I'm interested, but I don't have a grand understanding of those. And especially if I'm gonna get rid of the floor for reporting.
You're not gonna get ripped apart on this one, we won't let that something, and we've got, and here's the thing. When you report a bill like this, it's something that is agreeable around the room. There isn't controversy, we're taking out a section that was controversial. And if you need help on the floor, I will stand up and help.
Alright, wonderful.
And I can
Not
look
that-
at section by section as long as it's not today.
Yeah, and you're gonna have ledge counsel in the room. You'll have a section by section summary of the bill. And it's going down to finance and it's gonna be in finance for several days, so you have a lot. This is-
I got this from my professor at some point, right? Over my S59.
Green Mountain Care Board be the best ones that have been for that.
Who?
Yeah, these, okay.
The Green Mountain Care Board, yeah, and then
Yeah. All right.
So I know that we've kind of finished with Jen temporarily here, but before we move on, I'm getting messages now about the committee bill. So we'll start with 2 messages that I'm getting about the committee bill and we can decide, these are things we can correct right now, and we could do that. Or we can let the House deal with it. So one was an email from Hillary Wolf Wolfley of VPQ HC. And her request or suggestion was to add VPQHC to the advisory committee. Because they're the organization that can help in plan development with respect to, data and quality. Now, that's the question there. I don't know. I'm wondering if this is something that maybe the House could take up.
Yeah, and wasn't there an issue around appropriation if we were to join? We have to pay that?
Yeah, yes, you're right. So we'll leave it the way it is. But thank you, Senator.
They should have told us they need an appropriation.
Yes, so. Okay, that one. Then the other one is a request on a specific line item in the bill. Let me find the request for you. Let's go to page 18 of the bill. On line 19,
On the new,
please.
the new bill? or-
Yeah, our brand new,
Sorry, yeah.
like getting new shoes, right, before school starts. Page 18, draft 2.1, line 19. It says,
Page 21.
Huh?
Page 21.
No,
page
Oh,
18,
wait.
line 19, draft 2.1. And so,
Board may recommend.
no, the words are, that are asking about is, instead of, there's a word in there that says recommending, and they're suggesting putting in taking appropriate action versus recommending. So let's look at that.
It says recommend or take appropriate action.
Where are we?
Where are you on the bill? You're Ray here.
Board may recommend.
The board may recommend or take appropriate action.
As necessary.
Yeah.
And so I'm looking at Devon.
Devin from the Vermont, Kevin Green. Education of Hospitals and Health Systems. We were thinking that make recommendations, keep it in there and delete, take appropriate action as necessary. It's a vague term that would have broad consequences for hospitals.
I'm looking at the board.
I'm thinking, who would we recommend to, or is it just?
I think you recommend to the network,
To the network.
Yeah.
perhaps in the sense of, here's what we recommend. We may do it if you don't.
Yeah.
But we want at least the, to take appropriate action.
Are we okay with this or what? What did you?
As written. I think.
You want to keep it as written?
Or take.
I think let's keep it as written and then the House will have to take the issue up.
Question.
Unless, what is your,
I would say that I do agree with that. I think it is a little vague to be used as a cudgel against the hospital's term.
well, it's a network. we're talking about.
Absolutely.
But if you just recommend, if you recommend something, there's no
Teeth.
teeth to it.
Yeah.
And we're looking for teeth. We are looking for teeth here.
We've been recommending for a while.
Yeah, but a lot of recommendations have been made. Yes,
Devin Green, can we limit it to take action as prescribed in this section or something like that, so that it's not so broad? I mean, that sort of leads into any action. We
appropriate action.
Says appropriate action.
It does say
just
appropriate
like,
action.
yeah, I know, but appropriate could be anything. So what
Appropriate
we're
to
saying is
concern.
limit it to the tools that the Green Mountain Care Board currently has, basically.
I think the issue is that the board doesn't have tools.
Right.
I mean, they have enforcement authority.
Right, not for a network.
Right, but we would say, we would
This is
connect it to the
on-
enforcement authority.
This is for a hospital network, no change.
Jen, can you help
This is
us
for all us here.
to understand what, or take appropriate action? If we take that out, what does that take out?
That takes out the board's authority to
do
take action. Right, I mean, you could be more specific about what types of actions you are envisioning. I don't think we've taken for testimony on that, so I wouldn't know how to describe what that looks like.
What is the
but-
board's comment on this?
We support the language as written.
I know, but what are the appropriate actions that might be taken? What's the authority that the board would have from your perspective?
We would, we just had a discussion upstairs about some of the issues that are happening.
I
in the
can't hear
healthcare-
you.
Oh, sorry, if you look at the current healthcare system as it stands now, I think that we need the tools in our toolbox to take actions. I can't say exactly what they would be right now. I think we could discuss this further in the House on what that could look like and expound, perhaps. I'm not prepared to say exactly what we would do right now. But I think without the take appropriate action, as council has said, we do not have any authority over the Vermont networks as it is now.
Okay, thank you. That's helpful. Senator Douglas?
Question for Jen.
Uh-huh.
Jen, can you explain the appeals process in section 9381?
Let me pull it up.
Is it related to this?
Yeah,
Yes,
yeah.
it is.
Okay, that's
Yes.
on there.
Hold on. Okay. Now. All right, so under the existing statute, the board shall adopt procedures for administrative appeals of its actions, orders, or other determinations. Those procedures shall provide for the issuance of a final order and creation of a record sufficient to serve as the basis for judicial review. Any person aggrieved by a final action order or other determination may, upon exhaustion of all administrative appeals available under subsection A, appeal to the Supreme Court pursuant to Vermont Rules of Appellate Procedure. If an appeal or other petition for judicial review is not filed with an order of the board, then the sheriff can file a certified copy with the clerk of the court and sort of administrator, the technicalities and how that works. The order, I believe. I file a certified copy of the final order of the clerk of the court of competent jurisdiction. It has the same effect as a judgment of the court and may be recorded, enforced, or satisfied in the same manner as a judgment of the court. Decision of the board, that's great. Saying that a rate review decision is considered a final action and may be appealed. So that's effectively what we're saying is they have procedures for administrative appeals, and once exhausting administrative appeals, the appeal is to the Supreme Court, which is the way with some discussion about the budget orders, but the way a number of other of their boards' duties are or orders are appealed.
Okay, committee, going back then to the suggestion. Do you want to comment?
Yes, Jessica Oskey, the VAM Health Network. What I was hoping it would be that it would read, the board may recommend appropriate action as necessary, removing the words or take. And I understand that that there's a need, the board feels the need to take appropriate action, but this is very broad. It's regarding any aspect of the structure of a hospital network or its financial operations. And if the board recommends, and we're trying to get to a place of trust and negotiation, this is a huge hammer in an area where the board has not been acting before, which is looking at the structure of a network. They've never looked at the structure of a network before. And this just seems like a very broad, sweeping opportunity for the board to take action to correct something very broad in an area where we haven't acted before. And recommending action seems like it could be a way for sides to negotiate and come up with a agreement. Recommending appropriate action does not seem like a
Okay, I get it. I understand. So now you're asking for the board may recommend appropriate action as necessary.
Yes.
And what you're suggesting is more of a middle ground right now before the board has experience with networking. I understand that.
Or require a mediation plan or require a report
Right.
back.
Right. It can still go into an order. So,
I like the language is written for the record. We're doing a straw poll.
okay, let's do a straw poll. I will ask for the straw poll at this time. Who would like to say, leave the language as it is? Right. Who would like to modify the language that would be as suggested, recommend appropriate action?
So I'm looking for like a compromise here between the two, because it's either just, well,
We're not gonna go any further than that, I don't think, whether that, so you can,
We got how many minutes?
we got
this
3 minutes.
And we've lost our drafter. And
So, okay, so my suggestion will be, though I know there's a difference of opinion here.
I'm not gonna vote against. it.
No, let's hold your thought, please. Let's leave the language as it is. And then we'll come back, we'll know it's a flag. And we'll know that, I will, it'll be carried forward to the House. There's no question about it. So let's just leave it as it is for now. And that'll be it. So, yeah, I get it. I understand. And I know there's concern out there about over regulation when you're starting in on a new system. So I am sympathetic to that. However, we are where we are. So now, committee, we've got a 10-minute break, short break. Jen had to go to the floor. So we don't have ledge counsel, and when we get her back, which will be, I hope soon, we'll be able to give her our final input and move the bill forward. Thank you all. Good. Kiki, we're off. For break.